Hi, listeners, and welcome back. Before today's episode, let me remind you about our upcoming CME event, Extremities in the Carolinas Arthritis to Arthroplasty. This is May 20th through the 21st, which is a long weekend. It's in Charlotte, North Carolina at the Hilton Charlotte Uptown. The focus will be on upper and lower extremity osteoarthritis and arthroplasty. And with the live meeting and successful completion of the accompanying self-assessment exam, it'll be worth more than 20 hours of Category 1 credit. Please hurry and sign up today as space is limited. The orthoPAC, hosted by Sam Dyer. Welcome to the orthoPAC, where we discuss up-to-date orthopedic topics for the busy clinician. I invite you to sit back and relax as I attempt to fill in the gaps between education, current events, and real-world practice. Welcome back, listeners. Today I welcome Dr. Stefano Bini, an orthopedist with UCSF who specializes in joint arthroplasty. Dr. Bini is also the chair and founder of the meeting called DocSF, short for Digital Orthopedic Conference in San Francisco. Hello, Dr. Bini, and welcome to the OrthoPAC.
Well, thank you very much. I'm excited to be here and talk to you a little bit about what's coming down the pike in terms of the future of virtual reality.
I met you for about a minute or two at the AAOS. You were making your rounds, and I thought it was such an interesting topic that you had a discussion with me about. So that's how we came to today's podcast. And today's topic is on virtual reality and applications, and maybe some potential applications in orthopedics. I'm really excited to have you on to discuss something that I totally admit I have very little knowledge about. I did an esports podcast recently with gamers, so I'm familiar with the tech, but I think of Star Trek where they go into their little virtual world. When I think of VR, I know that's pretty simplistic, but I did do a little digging and research to prepare. And honestly, I want the lion's share of this talk to be from you. If you please would tell our listeners, what is virtual reality, where it came from, where it is today?
Virtual reality is a fascinating topic, and to loop back to the Digital Orthopedics Conference in San Francisco, we just had our sixth edition, and it's intended to drive the adoption of these technologies in the musculoskeletal space. And the reason I swung by was because we'd love to get more PAs involved, participating in our conferences, because we think you're all part of the ecosystem, part of the team that needs to adopt and utilize these technologies and see where the use cases for us, all of us. So in the space specifically of augmented reality, virtual reality, and mixed reality, because it is a bit of a continuum and it's worth taking those individually. The origins of virtual reality, in a way, you can almost go back to the 17th century and those epic paintings that envelop you across an entire landscape depicting battles. The concept is, how do you bring your perception into an environment that doesn't exist and make you believe that it's real? How do you project it in front of you into your field of view in some way so that you can feel like you're there? And then as the technology got more and more interesting, people started asking the question, how do you not only project it into your field of view, but also make it such that you can interact with it? That's where you get into mixed reality and some more complicated VR environments. So VR started out with this idea basically of as soon as computing started to enable the idea of creating virtual objects on a plain screen, how do you project that into binocular vision to give it depth of field? Again, the idea of using images looked at through different prisms goes way back. Now we're talking 19th century to create this three-dimensional visualization. But when we computerized it, it really picked up, I think, in the 80s and early 90s when we started seeing people starting to play with it. Augmented reality, in particular, initiated in an Air Force lab with the idea eventually to try to help recreate situations and give people a perception of reality. The long-term goal was always in the Air Force piece, of course, flight simulation, which is where some of the early augmented reality, actually virtual reality platforms started coming in on. But without getting too far afield in the history of it, today where it breaks down is into three buckets, really: virtual reality, augmented reality, and mixed reality. So virtual reality is the experience you have when you put on a pair of headset or goggle and you're in a completely different environment. Everything you see is fake. It's not, doesn't exist. It's constructed in your field of view. As the headsets got bigger and better, it allows you to look up and look down, look across, and have a bigger field of view. You can also move your head and see these new spaces. Some of the technological challenges that had to be overcome early on had to do with the delay in the response between the headset's perception or ability to test that your head is moving in space, and then to recreate that image in your field of view. That was called lag, and that lag gave you a sense of nausea instead of air sickness. That's 4 or 5 years ago. That's been largely resolved. So now you can get into these virtual environments and you can live in them for hours at a time and explore whatever it is that the designers had you explore. Different from augmented reality. So augmented reality is where, and most people are familiar with Pokemon, where you take a screen or a computer, in this case, a screen like an iPad or a phone, and you use the camera to show you the world as you normally see it. But then the software projects into that field of view something that doesn't exist in that field of view, really. So it could be the Pokemon, but it could also be instructions on how to manage an aircraft engine that you're working on. And somebody may be sending you the diagrams of the electrical circuitry so you know which wire to cut or whatever it is that you have to do. That projects it into your field of view. When you get into mixed reality, is when you start having these things projected into your field of view in augmented reality. In other words, you're now projecting, you're seeing through a clear lens, you're seeing the world around you, but in that field of view that you're looking at is now projected an object. It could be a chair. People may be familiar with some of the stuff that IKEA is doing, where you can actually put a chair you want to buy into your own home and see what it looked like. But then you can start to act on it. Imagine being able to reach out and grabbing it and moving it, because the software can see where your hands are and then understand that you're trying to grab something, knows how far away it is from you, and actually allows you to act on it. So the ability to act on something that's projected into your field of view in the normal world is what we call mixed reality. That is the breadth of the realities that we're currently talking about, with mixed reality being kind of cutting edge and not really that prevalent yet, because the headsets that are required for stuff like that is in the $3,000 to $4,000 per. So that's a quick overview of a very broad topic.
Great stuff. Great stuff. Dr. Bini, thank you for coming on today, taking time to share with our listeners. I hope to see you at another conference soon.
Yes, look forward to the fortuitous meeting and invite everybody to join us. We have a docsf.health. All our conferences are available by podcast on the Digital Orthopedics podcast, and also by video on our website. So if you're interested, your PAs are interested, we welcome everybody on the team to join us there. So thank you for the opportunity to talk about that.
Thank you so much. I really appreciate it. Thank you for joining the orthoPAC podcast. Please follow the Physician Assistants in Orthopedic Surgery on social media. Connect with us on Facebook, Instagram, LinkedIn, and Twitter. Please subscribe to our podcast. If this has been helpful, please take a moment to leave a review.